Hi, everyone. My name is Leah Terry. I'm a program coordinator here at the Network for Public Health Law, and thank you so much for joining us today. Welcome to the Network for Public Health Law webinar, Racial Health Equity Information Session, call for applications for network-funded law and policy assistance. Again, thank you for joining us. I want to give you all a reminder that the presenter's slides, as well as a recording of this webinar, will be available on the network's website in about a week. You will receive an email when they're up on our website, as well as a post-webinar survey link, which we would really appreciate if you could fill out for us. Please feel free to use the Q&A function throughout the webinar if you have any questions, and our moderator, Q, will try to get to as many as possible. With that, I will pass it off to Q Dang. Q is the network's Managing Director of Legal Programs and Strategy. In this role, he oversees the work of the network's project teams in advancing law and policy solutions and providing direct legal technical assistance to those working to create healthier, more equitable communities. Q brings more than 20 years of experience as a public health lawyer, educator, and consultant to this role. He previously served as Vice President of Programs at Change Lab Solutions, providing law and policy technical assistance to support building healthier and more equitable communities. He's also currently serving as the network's interim co-executive director. Q received his law degree from the University of California, Berkeley School of Law and a bachelor's degree in public policy from Brown University. With that, I will pass it off to Q. Thank you.
Thank you, Leah. Hi, everyone. Before we get started, I see that there are so many of us who have logged in. I think there's over 100 of us that logged in here. And as Leah said, we're going to be using the Q&A function for questions, which we hope to get to a lot of your questions today. That's at the heart of what we're trying to get at today, is answering your questions about this call for applications. Before we do so, if I may, I would just like to warm up the chat box. So I'm going to just ask for you to locate the chat box at the bottom of your screen and just pop in where you're dialing in from today. And I like to just have a sense of where folks are and let people see each other. I see Columbus, Ohio. I see Washington, and now it's going too fast for me to read. But lots of exciting places, and I'm so excited that you are all here. Now, to distinguish that from the Q&A function, if you do have questions today, I will be checking out the Q&A box. I'll also be looking in the chat box just to see, again, where everyone's calling in from, but also to look for your questions for our amazing speakers. All right, I want to talk first a little bit about what the Network for Public Health Law is. Let me see. Leah, can you advance to the next slide? So at our very core, the Network for Public Health Law provides resources and technical assistance to people around the country so that they can use the tools of law and policy to improve the public's health and promote health equity. Last year, I had the opportunity through the network's state level public health advocacy project and report to talk to folks around the country in every state about their efforts to protect and promote public health. One important lesson from that project was that so many different approaches and considerations are being taken in different places. Nonetheless, every single person I talked to was invested in and motivated by addressing health equity, especially racial health equity. Regardless of what state people were in, what they could and could not say when working with lawmakers and other partners, whether or not they could use the words equity, racism, structural racism, social determinants of health, they were all deeply motivated in figuring out ways to accomplish their goals, which had health equity at its core. I believe that racial health equity is at the core of what public health practitioners and community partners around the country believe in. I think if you look at that chat box and you look at all the places that you're dialing in from, participating from, I think you are all committed to working on racial health equity and advancing these principles. And this is at the very core of what we do here at the Network for Public Health Law. So I'm so honored to be a part of this launch of this call for applications and also to introduce our speakers today. I'm gonna introduce all the speakers, and then I will turn it over to them to move through the initial parts of this program before we get to your questions. So I'll start with Dr. April Shaw. Dr. Shaw is the acting deputy director in our health equity team here at the network. She has expertise in breaking down the policy impacts of laws and illuminating how theory can inform practice. She also has expertise in racial health equity and is especially interested in thinking about how multiple inequities interact to create systemic disparities. Some of her areas of focus include mental health, suicide prevention, cultural healing and safety, and climate justice. April earned her PhD in philosophy from the University of Colorado at Boulder, specializing in social and political philosophy with a focus on gender and racial justice. She wrote her dissertation on severe global poverty and human rights, and she received her law degree, her JD, with distinction from the University of Arizona, James E. Rogers College of Law. Our next speaker will be Sarah Rogers, who is a public health policy analyst in our health equity team here at the network. Her expertise centers on the role public health can play in advancing equity, racial and health equity policies, and community-driven solutions. As part of this work, Sarah leads the network's participation in the Collaborative for Anti-Racism and Equity, a coalition of national-based partners, all working to understand and support the movement to address racism as a public health crisis. Sarah began her career in the United States Peace Corps, serving as an English language teacher in Bulgaria, and earned her master's in public health from the University of Minnesota School of Public Health. Our third speaker will be Kathy Hoke. She is the director of our Eastern region here at the network, and is also the executive director of the Legal Resource Center for Public Health Policy and a professor at the University of Maryland Carey School of Law. Kathy has been with the network since its founding in 2010. Her areas of expertise include maternal and reproductive health, injury prevention, tobacco regulation, food security, and environmental health. Kathy teaches public health law, legal writing, and legislative advocacy. She is a graduate of Towson University and the University of Maryland School of Law. With that, I will turn it over to April.
Thank you so much, Q. We're really excited to be here today to talk about the network's call for applications for legal and policy assistance to address racial health equity. I'm going to go through some of the key offerings that we're going to provide through this call for applications, which include legal and policy support to promote racial health equity. We're also seeking applicants developing or working on a specific issue that prioritizes racial equity. And we can assist with work that is at any stage of development. So if you're at the early stages of figuring out what issues or project you want to work on, you can still apply, because as part of the CFA, we can help you to define the scope of that project so that you have the tools that you need to move forward. So you don't need to have a defined project already in mind. Through the CFA, the network will also provide up to 40 hours of legal and policy technical assistance. We're going to discuss some of the concrete examples of what this looks like and some examples from a prior round that we did of the CFA. And through the CFA, the network will also provide training and a guided facilitated discussion to the cohort to provide opportunities to share lessons learned and build relationships. We think it's important that participants not only hear from us, but hear from each other and have an opportunity to build relationships with one another that can continue beyond the end of the project and the end of the CFA. Next slide, please. This is just some examples of the expertise that we have at the network. We have a broad range of knowledge in the use of law and policy to promote racial health equity. And these include in the areas of housing, food security, mental health and suicide prevention, harm reduction, communicable diseases, climate change, emergency preparedness, vaccines, data sharing and privacy, public health authority and operations, access to health services, community engagement, reproductive and sexual health, and declarations of racism as a public health crisis. As it says on the slide, we have legal and policy expertise in these areas and more. So if you don't see something on this list, it doesn't mean that we don't do it. This is just a sampling. In addition to the expertise that we provide through the Racial Health Equity CFA, we will also provide dedicated staff to work on each project. So you'll have a dedicated staff member to provide timely communications and engage in monthly and as needed meetings for each project. Next slide, please. So one question that you might have is, what is legal technical assistance? What does it look like? And one of the best ways to break that down is to just look at the types of assistance that we typically provide. So legal technical assistance can include things like research, assistance with implementation, connecting to other communities or organizations doing similar work. We can provide training to help you understand legal and policy issues, advocacy, and messaging. We also help develop laws, policies, or plans to address identified issues. We can also work to identify model laws and policies. And we also create resources and connect you to other resources. Although the network does provide information and resources through legal technical assistance, we do not provide legal advice. So for legal advice, you would need to consult an attorney. Next slide, please. And I'll pass it over to my colleague, Sarah.
Thanks, April. Great to be with you all. For the next few slides, I'll be going over specific aspects of the applicant process and the application itself, including organizational and project eligibility, expectations and timeline. So who's eligible for the CFA? As stated here, we're looking for local and state tribal health departments, community-based groups, nonprofits, professional organizations, healthcare systems and providers, and others working to eliminate deep systemic and racially driven inequities in health. Coalitions are welcome to apply, which, any organizations that are working together on a specific project or issue, and priority will be given to new applicants. Limited funds are also available to participate for under-resourced organizations. In your application, you will need to identify the name of your organization, its type and location. We also ask you to identify and share the contact information for at least one project point person who will be the point of contact on the project and who will need to be available for monthly check-ins. Next slide, please. We're interested in supporting organizations and projects that have most, if not all, of the following characteristics. You will be asked to share some of this information related to these characteristics in your application. Applications include having a clear commitment to further racial health equity, are community-led, are grounded in principles of health equity and the priorities of communities that have experienced inequitable health disparities. Projects could be implemented in other jurisdictions or communities and are led that are engaged in working with communities, either currently that are seeking assistance with how to connect with communities. Projects can have a well-defined legal and policy scope or benefit from planning assistance to define the legal and policy scope and have a clear connection to improving population health. They can also include practical steps to implement action items, such as through the declarations of racism as a public health crisis. Next slide, please. As a reminder, you'll be asked to identify point people and the specific issue or issues that the network, you're asking the network to provide technical assistance support for it as part of the application process. cohort commitments and expectations include, participating in an upcoming training in the fall and next spring, and also participate in the evaluations at the close of the projects. This is also just laid through the applications that, the application form that is available on our website. Next slide, please. Next is the, here's our timeline for the next 7 to 8 months. Our call for applications are due at the end of the day on Monday, September 9th. Please submit your applications at the link provided using the button available on the CFA webpage. This is also available at the end of this presentation. Then the legal and policy technical assistance support will begin approximately in October, once you receive the notification of acceptance and of acceptance in September. We anticipate all projects being done by end of April 2025. And then, as you see here, then the events that I previously mentioned in the fall of this year, and then in the spring of 2025. And then again, here's the dates, May and June for the project evaluation. This will most likely involve a survey and a call from one of our colleagues to talk about how the project went. And next slide, please. And I'm going to pass it over to April then to talk about the benefits identified by past participants of this project.
Great, thanks so much, Sarah. So we wanted to talk about some of the benefits. We have done a prior round of the Racial Health Equity CFA, and we think it will help ground your understanding of what you're going to get out of the CFA. And also then I'll talk about some of the specific issues that we worked on just to make it a little bit more concrete. So some of the benefits that were identified by the past cohort include, first, just having access to free, high quality public health and racial equity focused legal technical support. So just having access to our expertise, our time, the ability to reach out to us whenever you have questions or as projects evolve. The second benefit identified by past participants is having access to this legal technical assistance was really important for organizations and entities that don't have access to attorneys. So a lot of the groups that we worked with simply don't have normal access to attorneys to consult on legal questions that they might have or policy related matters. A third benefit that was identified was that through the CFA, we were able to support small teams with limited capacity. For example, there was one group that was a 2-person team, and they just simply don't have the time to do the research and look into the law and policy issues. And so they found it particularly helpful to have the network expertise. And the fourth benefit identified was having access to each other, to the cohort, and the ability to build relationships with each other and to connect to other cohort members doing similar work. And as I said, that's one reason why we're having the trainings and the guided facilitated discussions, because it's really important that you connect not just with us, but you build that relationship with each other and learn from each other. Next slide, please. So my colleagues Sarah and Kathy are going to do a deep dive into some of the work that we did in the prior Racial Health Equity CFA, but I wanted to provide just a quick snapshot of some of the projects that we did, just to give an idea of the scope and expertise and that we have at the network and just the diversity of projects that we assisted in. So, for example, we assisted with implementing a local resolution declaring racism to be a public health crisis, addressing social isolation experienced by seniors of color. We helped with increasing access to inpatient treatment for Southeast Asian populations, with tools for evaluating racial equity impacts of legislation, identifying state laws addressing Black maternal health, addressing legal obstacles to hiring formerly incarcerated people as community health workers, with implementation of a health in all policies initiative, identifying community-centered mobile crisis response models that are not law enforcement centered, licensure of lactation consultants, and misuse of excited delirium diagnosis against people of color. In addition to providing legal TA through the prior CFA, these projects led to further collaboration that went beyond the CFA. So, for example, the network hosted a webinar on hiring formerly incarcerated people as community health workers with the project that they worked on. That provided space for community members to contextualize how law and policy affects lives. This was important, particularly for discussing issues that directly affect health and equity, but are not always discussed among public health practitioners. The CFA can provide opportunities to educate health department staff on the lived experiences of those directly affected in conjunction with the legal and policy aspects. And just another example was one of the cohort members also presented at the network's Health Equity Conference as part of a panelist discussion on community perspectives on addressing health and racial health equity and issuing declarations of racism as a public health crisis. So there can be further opportunities for shared learnings and collaborations that grow out of the CFA, which also help to advance racial health equity. And with that, I'll turn it over to my colleague, Kathy, who will do a deep dive into one of the projects that her team worked on.
Hey, Kathy, can I pause for a second? Can I jump in for a second? We've got a, thanks, Kathy. Thanks, April and Sarah. We've just got a few questions that have already popped in that I just wanted to get to first, because I think they deal with some of the logistical and administrative parts of the application that have been covered so far. The first question I wanted to ask is, can you define the end of the day deadline on September 9th? What time zone should we work with?
Yeah, so end of day would be end of day, whatever Eastern time. So I guess just the end of, we can have it open.
I'm not
until
pulling the
midnight.
applications until the following day.
Okay, thank you, Sarah. I was trying to think, what's the latest time zone? So
Or it would, yeah.
all day on September 9th to submit your application.
Yeah, it's pretty lenient. We are officially on Central Time here at the Network for Public Health Law, but we work all over the country, and we have our staff work all over. Something I tell when I set deadlines for the classes I teach is it automatically sets it for midnight. And I think that the 5 o'clock Central is a useful one just for your own stress levels. But like Sarah said, she's not going to pull the application. So it is truly end of day. If selected, are agencies required to sign an agreement to participate?
No, you're not required to sign an agreement. But as you'll see through the application process, we do, to make it successful, we do expect people to be available on a monthly basis and to have at least one point person of contact. But there's no agreement required.
Gotcha. And there's a bunch of other questions that have come in, but the only one I think I want to get to before moving on is, well, two. One is there a minimum requirement for technical assistant time with network staff?
That question, I'm not sure if it's directed at the network staff or participants, but for the network staff, we'll provide up to 40 hours of legal technical assistance. And so we are looking for projects that would kind of fit within that time. And then in terms of the participants, the minimum requirement would be, you know, just making yourself available at least monthly and participate in the trainings.
Great. A few of the substantive questions I'll get into after we hear from Kathy. There is one thing maybe we could I'll ask Leah to pop into the chat. Is there's a question about how soon slides will be available, and I know that's next week. But that shouldn't prevent folks from applying and working on their application. So if we could put the link to the applications into the chat also, that would be really helpful. All right, we'll get back to more questions in a moment. Back to you, Kathy.
Terrific. Thank you. And thank you to my colleagues, to Q, April, and Sarah, and on, you know, kind of setting things up. I'm actually going to talk about one of the projects that the Eastern region managed during our last round, so that you can just see how it unfolded. And I think it might help answer some of the kind of subject matter or substantive questions that started to pop up in the box. So first, this one clearly addresses racial health equity, right? So we were talking about Black maternal health in New Jersey. But to be clear, you know, when we talk about racial health equity, we know there are things that are direct impacts, right? Trying to create an anti-racist public health system, however, requires us to look at some indirect ways that certain populations are continually marginalized and subject to, you know, structural racism. And so I wouldn't worry so much about whether it's a direct connect, but whether you can demonstrate why the issue that you're interested in working on does have that racial impact of some sort. But for us, again, it was Black maternal health in New Jersey. And we, the applicant for us was a community-based organization in New Jersey. Shout out to, I saw some Trenton people and other New Jersey folks in the chat announcing themselves. We were really happy to work with our neighbors. I'm in Maryland with our neighbors in New Jersey, and they really came to us. They were an example of a requester who came to us with, a lot of experience in this space. So they have been working in Black maternal health for some time. They had a good lay of the land as far as what kind of policy options had been considered in New Jersey and kind of where the state was. But they didn't have it cataloged anyway. They just were going based on, kind of what they caught on the fly of being in this space. And so they wanted to be able to have a better idea of the legislative proposals that had been considered in the state over the course of a couple of years, to better understand where New Jersey was situated with its law and policy in this space as compared to some other states, particularly some neighboring states, and what opportunities New Jersey has to adopt policies and laws that would improve health outcomes for Black pregnant and birthing people. So our initial meeting, so this is the best part of it, right? Is that initial meeting. I know one of the questions is, what do you need from us? That initial meeting is super important, that you come with an, kind of like no fear of talking about what it is that you are interested in from the network, what the subject matter is or subject matters are that you might be interested in getting feedback on, being somewhat over-inclusive about who might be part of that conversation on your side, so that we can really hear from you. Again, you don't have to come in saying, this is what I want from you. That's not the way it went in New Jersey. They talked to us about the persistent problems facing their community with respect to Black maternal health, and kind of what some of the small p policies they were working on, and kind of what they had heard from the legislative realm. So that first kickoff meeting is super important, that again, you come with no fears. We are here to kind of help you figure out how we can help you, right? And so come with that really open mindset, and don't fear that you don't have a plan. That's part of that process. Again, probably my favorite part is figuring all of that stuff out. Then we personally did have, for this project, kind of regular meetings throughout the course of, I'm going to say, a semester. It was about 6 months. I teach a public health law clinic, and I had students engaged in this process. And so it was over the course of that clinic semester that my students engaged in. So we had regular meetings. I'm not even going to say whether it was monthly or 3 weeks. I can't remember. But it was, kind of when we said, oh, it's time for us to have a meeting, right? And we would schedule a meeting, and we would talk through, okay, after that initial meeting, the next meeting was, here's what we think we have the expertise and resource to develop for you. Is that of interest to you? And, how can we tailor that to your needs? And so we had kind of that meeting to go over creating what our products were going to be. And you can see here on this slide, we created both a fact sheet on Black maternal health for New Jersey. You can see a screenshot of that on the slide as well. That's on our website. We also have a similar fact sheet for Pennsylvania and for Maryland. And that contains some national data on Black maternal health, some New Jersey specific data on Black maternal health, and then kind of what laws are in place in New Jersey already and what opportunities exist for expanding law and policy in New Jersey. And then we also have an accompanying policy brief that's also available on our website that really takes this fact sheet and kind of expands the conversation about the causes of, poor health outcomes in the Black maternal health space, and kind of looks more at different options for law and policy change that would improve health outcomes for birthing people, for pregnant people in New Jersey. And then another part of it that we did that I say this probably caused us to exceed that 40 hours, kind of goal or, promise that we've made. But again, I had students working on this, was what they really wanted to have an understanding of in New Jersey is what has been going on in their state legislature with respect to proposals related to, for example, expanding access to Medicaid for postpartum, and for how long. For other provisions, for example, how birthing people who are incarcerated, kind of some of the provisions as far as what care they're entitled to and the treatment of those individuals. And well beyond that, they wanted to know kind of what the bills of late had been considered. And so our students did a deep dive into 3 years worth of legislative history in New Jersey, created a chart so that they could see with links to all the bills that kind of were in this space, what happened to the bills, where, had they been voted on, did they just, die for lack of being considered, or did they pass? And so that was a chunkier part of the process that I think was really rewarding for our clients, so they could see, oh, these are already some legislative champions that we have that are working in this space. These are ideas that folks already have. How can we enhance them, or how can we support those legislative efforts? And then after, kind of the back and forth on the products, and they were finalized, we had a closing out meeting with a community-based organization where we really just use it as time. They kind of did a lot of talking amongst themselves. And so we were more a convener, they forced themselves to be on this call to talk through the materials that we had given them and strategize internally about what were the priorities for them kind of moving forward. And so in some respects, we were just listening there to answer questions that they might have. But I would say that the value in that is, I'm sure, many of you on the call have this experience of, you are so busy on your day-to-day activities and, getting your work done, that you don't sit down and do these strategy sessions. And so it was kind of a forced strategy session for them that they got a lot out of. And that was, I think we went like an hour over our hour-long meeting. And I felt, it was really effective because they were doing kind of talking amongst themselves and figuring out those priorities. We have had a few kind of just follow-up emails or the like with them, and then the products on the website have certainly caused others to reach out to us with questions in the Black maternal health space. So certainly a win-win for us and the CBO that we served. So there you go. That's my example. And I think I'm passing it to Sarah, right?
You sure are. Hi again, all. So I'm just going to be briefly talking about our project that we did in the last cohort. So the applicant here, our partner, was a perinatal community-based wellness organization in Rhode Island, that is primarily focused on eliminating health disparities for Black birthing persons. They were requesting assistance and were concerned about Rhode Island's lactation consultant licensing regulations that limited access to care, as well as opportunities for reimbursement to mothers and lactation support workers of color. Their question was really, how can we change Rhode Island's lactation consultant licensing law in a way to achieve more equitable and diverse workforce? So as part of this project, we conducted research on lactation consultant licensures and statutes and regulations in Rhode Island and 3 other states. We connected with Rhode Island Department of Health to understand their rulemaking process. We identified several payment models for lactation consultants in other jurisdictions. We assessed the impact of Jackson versus Raffensperger, a case that was in Georgia impacting their lactation consultant law. And then we also reviewed proposed changes to the lactation consultant legislative regulations with the Rhode Island Department of Health, and keeping the community-based organization in the loop as well. As a result of this project, we did create an issue brief titled "Creating an Equitable Landscape for Lactation Consultant Licensure in Rhode Island." This is what we shared with partners before publication for a chance for review, and it's also available on the network's website. It also got recent attention through the Utah Office of Professional Licensure, who is also looking into exploring licensure of lactation consultants in their state. In addition to creating these products and doing all of this research, we also coordinated meetings between the community organization and the Rhode Island Department of Health. We met with Rhode Island to learn more about the practice of lactation support in the state, and reviewed the proposed changes, as I've already said. These revised regulations were submitted in June 2023 with more inclusive language that expands who is covered under the licensing requirements to other types of lactation support workers. However, the health department ultimately decided that these suggested revisions will not be implemented. Fortunately, in the last legislative session, the Lactation Counselor Practice Act of 2024 was signed in June, and it specifies the requirements and the procedures for licensing lactation counselors to be more broad. So in the end, our community-based organization partner, we ultimately was able to get towards that goal of creating a more diverse and more equitable lactation care provider workforce in this state. This lactation consultant project is a great example of what we can do working together, and can not only lead to new connections, resources, but then influence in other ways and across the country. Passing it on now to Q to wrap us up.
Thanks, Sarah. Actually, so we've got the slide now up with some contact information for April and for Sarah. And you can also see in the chat slide, in the chat box, there are links for the application and materials. That's there. So please cut and paste that in there, Sarah. Put that in the chat box. Right now, before I open it up for more questions, I'm gonna maybe go back to Kathy, but of course, Sarah and April, feel free to chime in too. Kathy, you, I think when you talked about your work with the Black maternal care in New Jersey, I heard you talking a lot about how you use the 40 hours of time. And a lot of the questions that have come up are about that. We had a previous question about the minimum time requirement, which I think was related to this. There are questions. If a project is chosen, will the network let us know limitations on the scope of our project 40 hours of TA isn't long. Could you describe the time commitments for those monthly meetings and trainings? Is it 8 hours 1 week, 10 hours a month? Is it case by case, project level, project based? Yeah, could you talk about that process? And then we'll see if April and Sarah have any other thoughts.
Sure. I mean, so interestingly, we did have another project that we worked on here in the Eastern region, which I didn't highlight there, and that was kind of a different experience. So for us in the maternal health, so it is really a case by case, right? In the maternal health, because it was there was some, I keep calling it chunky, but like, substantial amount of like research work that needed to be done on our end. It was, kind of us in the beginning, not overcommitting ourselves, coordinating with what is most important that the client get out of this, and so we work in that first meeting, and that second meeting kind of is designed to say like, with this time, what is most important to you? And again, the fact sheet and the policy brief were the priorities for our applicant in that in the maternal health one. The legislative stuff we kind of did as again, somewhat of an add-on. I did have, as I said, clinical law students who worked on that, and that wasn't probably part of the 40 hours because they're getting a pedagogical experience out of it, and also they loved it, and so that was easy. On our other project, I can tell you, was actually a much slower start. The organization came to us with less of an idea about what they wanted. We were collaborating actually with another region, and so it really was a slower paced process. And when we did figure out kind of together what was most optimal, it was really some core research that we provided for them with, again, that final strategy meeting that we walked through with them. So for that group, it was a lot of downtime between our communications where they had to kind of figure out on their end and run things through what they really wanted. And then once it was figured out, we undertook kind of the scope of our research and writing for them, which actually ended up being internal documents for them and not stuff that got onto the website. Again, another reason I picked the Black maternal health one. So, and you're right, 40 hours seems evanescent at the start of things, but we're a pretty power-packed organization, so 1 hour of our time is like 2 hours of a regular lawyer's time.
Thank you, Kathy. What I hear you saying, the quote that I heard you that I just want to stress is, with the time, what is most important? That's the question that our team will go to the group with, is what is most important to you, and to try to use that time in the way that makes the most sense. And so it also sounds like there's some kind of a scoping process at the beginning to determine what the scope of work is, and then follow through that way. Is that right?
And that's the case with the Rhode Island example as well. There's a lot of the scoping, and the core work was the research into the other state approaches, then to serve as evidence for the potential real change and change in law.
Great. We have several questions have come up about types of projects. So I'll throw them out here and see who wants to respond to them. April, I loved your slide with all the different types of examples that we had in this previous cohort. Some of the questions have specifically asked about whether we've had any experiences with this call for applications of working with a health system or a hospital, or whether we'd be interested in a project dealing with workforce issues, working conditions, and pay, as well as communities that have been over-policed.
Yeah, I mean, we are open, right? So we've written this really broadly because we really do want to provide support to a variety of organizations. As one of the questions in the chat had asked, if you needed to be an official 501c3 to apply, you don't. You can just be a collective of people working on something related to racial health equity. And so as long as there's that link to racial health equity, we want you to get creative. We want to support a variety of entities and a variety of projects. So there's no limits to who can apply or, topic restrictions. What we're really looking for is, does it fit within the scope of the type of legal and policy assistance that we can provide to help further these projects?
And I think too, to Toby's question about working with healthcare entities or organizations, I pulled up your LinkedIn real quick, so I know what you do. So I will give you an example of work we've done outside of this RHE CFA project, but in other projects with similar entities. I, for example, work with the University of Maryland Medical System Shock Trauma Unit on injury prevention stuff. And so I've supported them in creating a coalition of folks to fight off, if you will, the elimination of our motorcycle helmet requirement. Because our shock trauma people care a lot about that here in Maryland. But so really, if there are policy issues within the injury prevention space that a healthcare entity is wanting to wade into, we can certainly support in that realm. And then we worked we do a lot of work with school nurses through our school health work that Carrie Lowry on my team manages. So we are, in this space with healthcare entities, and super ready to jump in.
Great, thank you. There are some questions about whether folks can apply together or more than one organization, or are you looking specifically for CBOs, health departments?
Sarah, you look like, oh, you're on mute, Sarah.
I'm mute. Yeah, here it is. I know I was going to be on mute eventually. So yes, so organizations working together on a particular topic or issue can apply on one application. You'll just need to choose one organization to be the lead, or the collaborative or coalition group, if it has a name, that can be in there. What's important is that you identify the point person who we can connect with to coordinate and talk to related to this project. There's spaces for one point person and in a second. So depending on who's part of this project, feel free to of course choose one, but then there's identify two as part of that process. But we welcome coalitions and collaborative projects for sure.
Great. We've gotten several questions about funding. I think we've talked about what we've heard from our panelists about some of the benefits that are involved in participating in this program. It does involve a stipend. Could you talk a little bit more, April, about the stipend and other benefits?
Yeah, so the primary benefits from the CFA are the legal technical assistance, the training, the ability to connect with each other. We did want to offer a small stipend equivalent to a small honorarium to honor community time. And so it's not a large amount, but we did want to provide, recognizing that it will take time, and going back to the question of, will we ask you to spend 8 hours a month meeting with us and talking with us? We won't. The meetings are usually, the monthly meeting would be about an hour. And so we ask that you review the research that we send you. But our goal is to not make it a heavy lift on you. But we did want to provide some small funding, like an honorarium for under-resourced communities.
Yeah, so it sounds like the main benefit is the 40 hours of technical assistance and the products and the communications. There was a question about communications that could be included in part of the scoping of the project that is done with our network staff. So it's not a traditional fund in the sense of a grant to applicants to spend money. It's an honorarium for time, and it's the use of 40 hours of legal technical assistance. Is that right? Okay. All right, I wanted to shift focus. There's a really interesting, some really interesting questions about the sorts of things that we prioritize. There's a question, do you prioritize Black and Brown-led under-resourced organizations that are proximate to communities that are impacted by racial and health inequities?
Yeah, I would definitely put that in your application. If you going back to the slide on the factors that we consider, one of them is, is it community led, and obviously having this is a technical assistance on racial health equity, and so having people without lived experience that are connected to communities that are part of the community would be a weighted factor that we would consider. And so definitely include that in your application if you decide to apply.
I have a question about whether we've worked with any tribal state projects, such as data sharing between state and tribe or tribal data sovereignty policy.
So we do have colleagues that have worked on those issues a lot extensively outside of the CFA, but that is definitely something that if you're interested in doing that work through the CFA, you can apply. But we, as a network, that is something we've worked on, and it would be a great project to submit.
There's a few questions about the number of applicants and how often we do this. Could you give us some idea of that selection process and the frequency of this opportunity?
Sure. So last time we had 13 that we had accepted. The number of groups applications that we'll accept will depend on the scope of work and the types of applications that we get, but it was 13 last time, and this is the second time that we've offered it. So if we were to offer it another round, it would probably be in 2025. The first cohort was trying to remember, about a year and a half ago. So this is definitely something that we think is really valuable and something that we want to keep going.
Yeah, I'll add to that also, just that it's a 7-month process, right? From the start, the scoping of the technical assistance, and then trying to finish the technical assistance. And then, as Kathy said, there are some follow-up, that may happen after that. And we certainly are open to that, as organization network is funded to provide smaller amounts of technical assistance outside of this 40-hour opportunity. It's a fantastic opportunity for us as a network to work on the issues that really matter to us, and we're really excited about all the ideas that are generated. I think one of the examples that April called out in her presentation was about the work that one of our teams was able to do in looking at the legal obstacles in different states that prevent formerly incarcerated people from becoming community health workers. We had a question about workforce. We have, a question about, about the key social justice issues that we're interested in. And the opportunity to work on something like that is so fundamental to who we see ourselves as an organization, that we're really excited to see what you all are working on and be able to work with you on them. I know there are a lot of other questions there are some other questions in the chat box. We'll try to answer them directly as we go through there also. We can respond to many of those directly, and I think we've responded to most of the questions. I wanted to, in the couple of minutes that we have left, I wanted to go back to our panelists and see if there was anything else that you wanted to make sure from looking at the questions or the direction of our conversation today. Anything else you wanted to add before we finish at the top of the hour?
I'll just do my one disclosure that I always want to do on behalf of the network, and that is just to be mindful, even though I talked about, tracking legislation and, discussing legislative proposals. The network is not able to lobby because of restrictions on our funding through our funder. And so we would fall short of being able to draft legislation or advocate for particular legislation. So think of us as your behind the scenes team more than the face of advocacy.
Yeah, and I would just add that really the work that you guys are doing is so important. And so we really value this project and just being able to hear from people that are directly working with communities and being able to support that work. As much information as you can provide on, the communities that you serve, the type of information, what assistance you want from us, even if, as we mentioned, it's just help us identify what we should do, is really helpful. And in terms of the timing of things, I did want to add that if you are a member of the cohort, the evaluation and closeout, which will include a survey and a brief interview, is really important to help us to see where we can strengthen the CFA and provide better support.
Can you pull up our slides again? Yeah, we've got some information in the chat box about folks you can email, different folks at our team, as well as the information for emailing April or Sarah also. So yeah, it was great to have everyone. Back to you, Leah.
Thanks, Q. Thank you all again for attending today. I just want to remind everyone that these slides, as well as a recording of this webinar, will be up in about a week, hopefully less than a week, but September 5th at the latest, on the webinar page. And you all, by registering for this webinar, are on the email list to receive an email notification when those are posted, as well as a post-webinar survey that, again, we'd appreciate if you could fill out for us. Again, please reach out to April or Sarah if you have any questions on the CFA, and thank you all so much for joining today. Have a good one.